Casperson coming to you from Pacific Northwest Urology, and today I have the great privilege of interviewing Dr. Daniel Reznicek, who just became the third Center of Excellence in Washington State for UroLift. So today we're going to talk about UroLift. Welcome, Dr. Reznicek.
Thank you. Thanks for having me.
So let's go back. Why did you have an interest in urology?
I tried really hard not to be a urologist. My dad's a urologist. I worked in accounting for a long time, went to business school, but then found myself wanting to interact more with people and do something that impacts people's lives. I found medicine, kind of call me. So went into medical school, again, tried really hard not to go into urology. I did a lot of surgical subspecialties. I do like operating. I like working with my hands. I like being able to fix things. I feel that the surgical field allows us to fix problems in one setting, whereas medications, sometimes it's just not as gratifying to me. And again, after a long search, I found myself kind of pulled towards urology, even though I tried hard not to. I like the patients. I like the personalities. I like that we have problems that we can fix rather easily, and patients have very good outcomes. It's very gratifying to treat patients with kidney stones, with cancer, to be able to cure them. And then as far as urinary symptoms, even lifestyle things, it can be, people might think they're little things, but they can have a big impact on people's lives, and people are very happy. So urology is a nice specialty that combines a lot of different things that I enjoy.
And I think a lot of people don't know that even within urology, there's a lot of little niches. And you've really taken an interest in men's health specifically. How did you find that was your interest out of all the different areas in urology?
I feel that men's health, at least in residency, was a subspecialty that was kind of overlooked, at least in my residency, a little bit. We did have Dr. Kramer. We did a lot of penile prosthesis work, but there's a lot of men's health that gets overlooked when there's cancer doctors, oncologists, big procedures at a medical center, but by and large, when you go out to the community, what is the vast majority of people's problems? It's the common things. It's things like, prostate and urinary issues. It's things like low testosterone. These are things that are big, important things. There's a lot of people that have them, and they're very satisfying to treat because people can have a big improvement in their quality of life when you treat these.
So break it down for us. Most men have prostates, almost all men have prostates, and enlarged prostate, or BPH. What's BPH?
Yeah, so BPH is a term stands for benign prostatic hyperplasia. It's actually kind of a poor term, but it's been used for so long that we just use it now. It's a pathology term, so it means that a doctor has looked at a microscope and looks at cells and says this is benign tissue. It's from the prostate and it's enlarging. But when you break that down, we call everyone that has BPH, they have these symptoms, and we label it BPH. We really don't have pathology to demonstrate it, but it's a very high chance that it is BPH. But what do we? That's the definition of BPH, but what are we using that term for? Well, we're using that term to describe a myriad of symptoms. Another term for that might be lower urinary tract symptoms, is a little more accurate term for the symptoms that men are having. But these symptoms include things like a slow urinary stream that develops over a long period of time, frequent urination, feeling that you're incompletely emptying your bladder, right after you urinate, feeling like you have to urinate again. These frustrating things that develop very, very slowly and indolently as you age, that you don't notice right away, but when they start to become a problem, they start to be far more noticeable. These things happen because, in general, when we're talking about benign prostate growth, which is far and away the most common cause, is the prostate grows both outwards and inwards, and the prostate sits below the bladder. And when you urinate, your urine has to go through the prostate. So that inward growth, that kind of collapses on the prostate, starts to slow the urinary stream. And it takes a long time because your bladder is able to compensate for that for years. But over time, it starts to affect the bladder, and the bladder has reactions to it. So you may notice the slow stream at first, you may not. Your bladder may have compensated for that, but it starts to develop some dysfunctional voiding, and men start to have a lot of symptoms that start to become very noticeable.
When should a man start thinking that he should visit a urologist?
That's a great question. It's funny, you meet with a lot of different guys and they come to you at different stages. And I find it interesting that two other guys that have the same exact symptoms, one guy is not bothered by them at all and the other guy is incredibly bothered by them. So a lot of it depends on the guy. If you're starting to be bothered by your urinary symptoms, you're driving from Bellingham to Seattle and you have to pull over twice. You're waking up 3 or 4 times in the middle of the night, or it takes you 5 minutes to pee when the guy next to you is done in 30 seconds. These are kind of things that you should be thinking about. Hey, maybe I should go see someone. Also, if you're bothered by the symptoms, some guys aren't bothered at all by their symptoms, and then, there's no reason for us to treat them because, there's nothing, affecting their lifestyle. You should see a urologist when it's affecting your lifestyle and impacting you in some way.
Tell me about some of the behavioral options for men. If they say, hey, I want to know if anything that I'm doing with my behavior or lifestyle is affecting my prostate and bladder.
Yeah, so behavioral things can definitely affect your urinary symptoms. Here in the Pacific Northwest, I think the biggest thing is coffee. We load up on coffee up here. There's a Starbucks on every corner. Coffee has it's a diuretic. It makes you pee more, but also has a bladder irritant in it. And so everyone who drinks coffee is going to pee a lot. So if you're able to cut back on your caffeine and especially coffee intake, that will help reduce the frequency of urination. Now, it's not going to make your stream any stronger if there is some sort of obstruction, but it may help with those symptoms. Fluid consumption is another big one. I find that if I have an interview with a man and his wife is always telling him to drink more liquids. And if you're not a kidney stone former, if you're able to cut back on your fluids, that's another way it can help with your symptoms. In general, some studies have also shown lifestyle seems to be an important role. It's hard to say because we don't have prospective studies looking at this. It might just be a correlation with healthy people have less symptoms, but people that are healthier, who have a healthier weight and eat healthy and have an active lifestyle have less urinary symptoms overall.
Wonderful. So if a man's going to come and see a urologist or come and see you for urinary symptoms, can you talk through what a normal visit might be like? What kind of tests you might want to do?
Yeah, so frequently when someone is coming in to see me, they've already seen their primary care physician. They've already perhaps started on a medication, or they're seeing me because they don't want to start a medication. They've frequently done some behavioral things already. Most guys have cut back on fluids, especially at night. Most guys have already figured out that the coffee is causing them to pee all the time. So when they come to see me, after reviewing the chart, doing a history and physical exam, frequently things that we look at include urine testing to make sure there's not a urinary tract infection. We usually measure their bladder after they've urinated to see if they've emptied their bladder all the way, because some men don't realize this, but a large portion of their urine is retained in their bladder after they urinate, and so they have to urinate much more often through the day. We also do screening for prostate cancer. If you have urinary symptoms, you should be evaluated to make sure prostate cancer is not the cause of the symptoms. It's not a common cause, but it's one that should be ruled out. If the symptoms are worsening and the medications you're on aren't working, frequently we'll also do some additional studies to see if you are a surgical candidate. Those include a cystoscopy or evaluation of your bladder with a camera, and sometimes an ultrasound of your prostate to measure the size of the prostate.
So like you were mentioning, there are some medications for enlarged prostate, but a lot of guys don't want to be on a daily medication or their side effects. What are the side effects of the common medications for enlarged prostate?
Yeah, so far and away, the most common medications prescribed today for BPH or prostate issues are alpha blockers. So alpha blockers, the way they work is they relax the smooth muscle of the prostate and the bladder neck and have a temporary relief of the symptoms as that opens up the channel slightly. Those medications are a lot better than they were 20, 30 years ago, and are more selective to the prostate, but they still can have some other side effects. Those include described one called orthostatic hypotension, where a man goes from sitting to standing and they can get lightheaded or dizzy. A lot less with the new drugs compared to the old ones, but still present. Other side effects include retrograde ejaculation is a common one that guys talk about. The long-term side effects are a little bit less clear. I mean, there have been some studies recently that linked those drugs to other long-term problems like dementia, but it's unclear if those are correlation issues or if that's causative. Likely not causative, because a vast majority of guys over a certain age have been on those drugs, and there hasn't been an increase in dementia recently. The other common drugs that are prescribed are 5-dihydrogen testosterone inhibitors. So those drugs block the conversion of testosterone to dihydrogen testosterone, and that's a growth factor for the prostate. So those drugs block a growth factor, and over a period of time, generally 3 to 6 months, cause the prostate to shrink in size. Those drugs have a lot of side effects as well. Some of them, if you get the box, they look terrifying. One of them says that it increases your risk of high-risk prostate cancer, although that's probably not true. I mean, it's still an FDA warning on the label. There are other side effects that are also bothersome. There's a uncommon side effect, but can happen, of erectile dysfunction, and in a very small percentage of people that can be an irreversible problem, and that's especially problematic for young men who are on the drug who develop that. One of the other side effects is hair growth. You may regrow hair, and that's what the drugs were originally designed for. Propecia is the same drug as finasteride. And those are kind of the main ones that we talk about. Less common things also are like chest tenderness or breast enlargement, but we don't see that very often, and it goes away if you stop the drug.
So one option that's now available is UroLift. When did UroLift kind of come on the scene as an option to help men with BPH?
That's a great question. I'm not going to remember the exact date. It's been in the U.S. market about 5 to 7 years. It's been available in Australia, where it originated a few years prior to that. Our data is about 7 years of good data use on UroLift. Although it's been in the U.S. for that long, it wasn't. It was FDA approved, but certain insurances weren't paying for it till about 4 or 5 years ago. So that's when it really took off. But we have very good data out to that 7-year period comparing UroLift to other procedures that we've had, like the transurethral resection of the prostate. And so the data on it out that long has been very good.
So can you describe the UroLift procedure?
Yeah, so when we talk about, again, why the prostate causes symptoms, it's that inward growth on the urethra. And the prostate typically has, for most people, 2 lobes, one on each side, and as they grow inward, it obstructs the growth. Classically, the procedure that's been around since the 1920s is the transurethral resection of the prostate, or the TURP. And what that procedure does is physically remove tissue using a camera that goes in and cores open a channel so that men are able to urinate more easily. And rather than actually remove tissue, what the UroLift does, and you can see our other videos on this, but what it does is places a small clip through the prostate, and what it does is pinches open the urethra. So it's a non-destructive procedure, so it's not removing any tissue, and therefore, because of that, it's much less invasive. It can be done in 5 to 15-minute procedure, and some men under a local anesthetic tolerate it very well. And because it's not removing tissue, it also has a lot less side effects than the transurethral resection.
So with the TURP, or the transurethral resection, you're coming in for surgery where you're having general anesthesia. How is the UroLift different?
Yeah, so TURP can be done with either a general anesthetic or with a spinal anesthetic. The UroLift is a much less invasive procedure. You don't need a general anesthetic. I still offer it for guys who want a anesthetic. It's still available. So if you find that you're afraid of discomfort, or the cystoscopy evaluation was uncomfortable, general anesthetic is still possible, but it's a very quick procedure. So rather than an hour and a half procedure, we're talking about 10 to 15 minutes. You're up, and if you have this under a local anesthetic, you're out the door in the next 10 minutes or so. Most guys don't require a catheter for the procedure, so it's uncommon to need that. Whereas a transurethral resection of the prostate, you're going to have a catheter afterwards for the next 2 to 3 days. There's a lot less bleeding after the procedure compared to classic procedures, and lower rates of erectile dysfunction and urinary incontinence.
So you're saying that men could drive themselves for the procedure and they can eat breakfast with a UroLift?
Yes, the vast majority of guys that we do here, I think about 90% we do under a local anesthetic. Sometimes use a little bit of nitrous oxide to help with that. And for those patients, that wears off in 5 minutes after the procedure. You're able to eat beforehand, you're able to drive home. It's a great option.
So tell me about Center of Excellence. You're the third Center of Excellence for UroLift in the state of Washington. Congratulations. How did that happen?
NeoTract has been a great job of expanding UroLift, but doing it in a very selective manner. They want it to be done so that they have the best possible outcomes. So some of the ways that they do that are they limit the number of physicians that they offer the procedure to. They want to only offer the procedure to physicians who are willing to go through the training and learn to do the procedure the correct way, so that patients have the best outcomes. And one of the other ways that they try to improve outcomes is the Center of Excellence program. They try to get certain individuals who are very motivated to do the procedure, that are doing high volumes of cases, to go through this program. And what the program does is requires the physicians who are doing it to track their cases and track their outcomes, which is good. So you understand, are you doing the procedure correctly? Are your patients having good outcomes? Are there ways that you can be improving it as you're going along? And so it's a great program because it requires you to look inwardly at yourself and see, are your results as good as you think they are? It requires you also to do additional training above the standard training to get able to do the UroLift procedure. The training involves traveling to another location, watching another Center of Excellence physician, doing some webinars, learning more about intricacies and potential small things that you can do to improve the procedure. I have to say, initially, when watching the video, when I was first learning about UroLift and doing it in residency, it looked like a very simple procedure, and everyone can be doing this, and it seemed very, very straightforward. But the more you do, the more you learn that there are some subtleties and some things that make it certain cases difficult and ways that you can improve. And so the program required me to do a lot of cases, learn from those cases, see what our outcomes are, and also do these extra educational programs, which I think really helped us improve our UroLift experience for our patients here.
It seems like the Center of Excellence really is multiple steps above somebody who might just be doing the procedure from time to time. So tell me, for a guy who's living in a different part of the country, how does he find somebody who has a Center of Excellence?
So NeoTract has a website. They're a great resource for a lot of different things. If you want to learn about how the procedure is done, also if you want to find a physician that does the UroLift procedure, you can go to the NeoTract website. They have a physician locator, and then right on that locator they have whether the physician does the UroLift, do they do it in the office? Also, is that physician a Center of Excellence? And they have the number of locations around the country, which is always increasing. So there's probably a Center of Excellence in your area. There's not one in every state, but they are certainly growing.
So after the UroLift, a guy goes home. Does he notice symptom improvement immediately, or does it take a while for it to kick in?
So a little bit of both. After any time we do any procedure on the prostate, including just a diagnostic cystoscopy, putting a camera in the bladder, most guys will have an increase in some frequency or urgency, or perhaps have some burning with urination afterwards. Those kind of irritative symptoms after having a procedure at all can linger around for a few days afterwards. But generally speaking, most guys notice a pretty dramatic improvement in their flow immediately following the procedure. One of the interesting things, starting the UroLift procedure is we started using it for urinary retention. And one of the kind of astounding things for us as a urologist was, some guys came in here with urinary retention for 3 months. They were too unhealthy to have the transurethral resection of the prostate. We did a 5-minute, 10-minute procedure under a local anesthetic, and we took the catheter out, and the guys were peeing within 10 minutes. So that was a pretty dramatic effect, and that does happen pretty immediately. Now, some of the side effects or some of the symptoms of BPH that we talk about, the lower urinary tract symptoms, especially the irritative symptoms that have happened because the bladder has become dysfunctional, those aren't going to recover overnight. Those have happened because your bladder has been dysfunctional for years, and it's adapted. It's become more hypertrophic so that the muscle fibers in the bladder have gotten thicker. It's less elastic than it used to be. The capacity has decreased. So the frequency or the nocturia peeing at night, those might take some time to recover. And in some cases, those may never recover. They may be irreversible changes that have happened to the bladder. But you got to fix the problem that's causing them first before we can start treating those symptoms.
So who would you say in general is a good candidate for UroLift?
So people are a good candidate for UroLift if they're bothered by their symptoms. You can definitely offer the procedure to any man that's coming in that's been evaluated that the prostate is the source of their symptoms. That's not some other cause like a stricture or prostate cancer. So once that evaluation is complete and there's a few certain things that make UroLift more ideal for patients. So size of the prostate is one. It works really well for prostates kind of small to medium size. The FDA has a limit on the prostate size of 100 grams, which is kind of a moderately large prostate. It doesn't work well for some very, very large prostates. Other things that UroLift works well for is if you have a prostate that's got the 2 lobes on the side. About 10% of guys have what's called a median lobe, or a lobe that grows inwards in the bladder. Although UroLift can be used for some of those patients, it's probably best suited for the patients with lateral lobe hypertrophy. And the last part is, like I said, symptoms that are bothering you. So if you have been on medications and you've had side effects, if you've been on medications that are not working anymore, or if you don't want to go on medications because you're concerned from the side effects of medications, that might be right for you.
So say you have a guy who comes in and he's already on medications, but he doesn't like the side effects and he doesn't like taking a pill every day because he's young and healthy and kind of just wants to be done with having to think about it all the time. How would you counsel him on the effectiveness of UroLift and the ability to stop the medications that you're on?
Yeah, that's a good question. So we evaluated our patients, or I guess I evaluated my patients over the last year. And of the 60 or so patients that we looked at, about 40 of them, we did the UroLift for that exact reason. So we call it just BPH, or lower urinary tract symptoms. And for those patients, we have a score sheet that labels their symptom score. And on that validated questionnaire, most guys went from a score of about a 20 to about a 10. And so about half their symptoms, maybe a little bit less than half. I think it was like 49% or something. So usually you can reduce your symptoms by about half with the procedure. And the number of guys on medications after the procedure was about 20%. So about 80% of guys were able to get off of medications from the procedure. It doesn't work for everybody. Now, TURP also doesn't work for everybody. The number of guys that had improvement was about 85%. So still about 1 in 8 men, for whatever reason, the procedure did not improve it. But even including those men in those numbers, the improvements overall were over 50%, or sorry, were about 50%.
Is there anything else you want people to know about UroLift or the Center of Excellence?
I think we went over most of the questions that guys ask. I think word is now getting out there more and more about UroLift as more guys have had the procedure and talking about it with their friends. It is a great procedure. Currently in Washington State, we have a complete ban on elective procedures that's supposed to be running out here in the next 2 weeks. So we're on hold right now. But about 2 weeks from now, we'll be opening up the procedures again as long as that ban isn't lifted. And it's a great option. Guys are very, very satisfied, and we're excited that we have new options for BPH, for lower urinary tract symptoms for men that are less invasive.
Wonderful. Thank you, Dr. Reznicek.
Thanks.